Hi students, we're going to spend a little time talking about the high cost of turnover, especially as it relates to both absenteeism and turnover. This can have a very negative impact on a facility, and so it's important for you as leaders to be able to understand this important dynamic so that you can help manage it well. Absenteeism and turnover. It's very common for facilities to experience both simultaneously. Facilities with lower rates of absenteeism are associated with higher seniority in the facility. So if you have a cluster of employees who report to work timely and frequently, and they fulfill their duties associated with their positions, they are more apt to be employees who have worked in the facility probably for a number of months or years, which is in the facility's favor. Both absenteeism and turnover equate to lower levels of quality of care. So anytime we have employees who are late to work, who consistently call in, that's bad news. Resident care is affected negatively. Poor quality of care is usually associated with this duo dynamic. So managing absenteeism and turnover will help to project future staffing needs. So it's very important to pay attention to rates of absenteeism and turnover simultaneously. There's a wide variety of reasons why employees don't show up for work. More than likely, it's for illness. Given that we're in a pandemic right now, we might have employees who are quarantining at home, but illness is usually one of the #1 reasons employees don't report into work. Some of our employees have transportation problems. Others have childcare problems. Childcare problems can take on many different levels, not only for if children are sick and moms and dads can't go to work, but then sometimes there's the problem with children needing to be transported after school, and so some parents do have to take off work for on these occasions. Might be daily, it might be on a rotating cycle, but childcare problems for parents who are working in long-term care facilities, that dynamic happens a lot. There's other personal family dynamics with generational needs. We see a lot of households where there are young children in the home, along with parents who are working, and also older parents, grandparents, or older aunts and uncles in the home. So when there are different generations living in one home, an employee stands a chance of having higher absenteeism rates. And again, going to work is one issue, and for some, staying throughout the day, that's a challenge for some employees with family dynamics at home. Some employees don't show up because of just low morale. Their peers are unhappy about the facility they're working in. Low morale throughout the facility or in the neighborhood. If it's a community with poor morale for working individuals, that certainly contributes to those who just don't have the desire to go to work. And then payday can be another dynamic for employees to not show up for work. Years ago, some companies paid their employees on Fridays. That was always a problem because it gives people an excuse to have a long 3-day weekend, go cash the check, and then not show up for work. Today, most companies do pay their employees. Some pay them now at the beginning of the week, which is mandatory payday meetings. That's why that's so important to be able to hand over the check or maybe even a direct deposit, but have it done at the beginning of the week instead of at the end of the week. That's very important. Measuring absenteeism. The facility must have systems in place to measure absenteeism. We want to know how often people are not showing up for work. There should be policies to be developed and followed for employees on what constitutes an excused versus an unexcused absence. If someone is, if they call in because they're sick, that is definitely an excused absence. But if someone doesn't call in at all and they don't show up, that's an unexcused absence. If they just call in at the last minute and say, hey, there's a new feature movie, and we've just decided as a family we're going to go to the movies this afternoon instead of working the 2 to 10 shift, that would be an unexcused absence. Record keeping for excused and or unexcused absences, there must be a system in place for record keeping. Calculating absenteeism. There's lots of rates on how to calculate things in long-term care, and absenteeism and turnover are very important that you understand these rates. So the rate for calculating absenteeism, it is a percentage rate. You take the number of work days missed over a certain time period, whether it's over a 2-week pay period cycle or over a month, divided by the average number of employees, multiply that by the number of work days in the same period times 100, and then that gives you your absenteeism rate. And we can practice these in class as needed. So again, on managing and measuring turnover, this is a calculation rate that can be used to measure turnover for one specific position. If the facility wants to measure C.N.A. turnover or nursing turnover, or it can be used to measure the turnover for an entire facility or for the organization, or maybe even for the region. So you take the turnover rate, which is to calculate this turnover rate, you're going to take the number of separations per time period. You might study people that have turned over for 1 month, 1 quarter, first half of the year, or for the entire year. You're going to divide that by the average number of employees during that same period, the average number of employees that have worked. Multiply that by 100. That provides you with your turnover calculation rate. And then managing absenteeism, in addition to the policies that highlight definitions of unexcused or excused absences, there must be other additional policies that follow. And one of those policies is excessive absenteeism. So, okay, you do have employees that are going to be absent from time to time, but who's watching, who's calculating the excessiveness of absenteeism? And when an employee reaches that point, and first of all, what constitutes excessive absenteeism? If someone's absent 6 times in a pay period, that's one thing, and that's not good. But if they're only absent, say, 6 times out of the whole calendar year, that's not so bad. So there must be a policy in place to help monitor and to help define excessive absenteeism before it leads to turnover. So supervisors must set aside time to counsel employees. If you're starting to notice C.N.A.s, nurses, housekeepers, dietary staff, if you're starting to notice as a manager, if the food service manager or charge nurse or housekeeping and laundry supervisor, if they're beginning to notice absenteeism is occurring, you must schedule and set aside time privately. You don't want to do that openly in front of other employees. You want to make sure that you're listening and that you're listening to find what is the reason for their absenteeism. And you want to be able to find helpful ways to support the employee if they're missing work on a regular basis. Some employees, I know at another facility just a couple of short years ago, there were 3 or 4 employees who were terminated because each of them were leaving early to pick up kids or drop kids off from school. They had young school-age kids, so it's important as an employer to listen to our employees. If they're good people, then you definitely want to try to salvage those relationships and don't have them leave to go work down the street at another facility or somewhere else. So we want to try to salvage the relationship as if we can. If you can, make it work. If it means that Sally may have to come in later or come in earlier because she has to leave early to pick up her children, then you might want to allow that employee that flexibility. I think in today's environment, we all need to offer flexibility where and when we can, but we must be consistent. If we do it in one department, we must offer flexibility in another department as well. Again, with turnover and retention, there's just usually in a facility, there's usually a very small core group of employees who are dedicated and have been there for a while. Sometimes it's for a wide variety of reasons, whether it's just the job they love, or if they are working in the neighborhood, or if it's a faith-based community and they just happen to love the idea and the mission of a facility, they will stay. But there have been lots of studies that say employees don't leave for more money. They usually leave because they have a good working relationship with their immediate supervisor. So I always keep that in mind. Turnover remains one of the greatest challenges in the long-term care profession today. It's a very difficult process, very difficult phenomenon. So I want to try to keep a handle on it by taking good care of your employees so they won't report, so they don't miss work, and so you don't experience high turnover. Kind of just some background, and this survey is not in your textbook, but it's one that I often refer to quite frequently. There was a study done in California, 2005, from the Department of Medicine, University of California, Irvine Center for Health Policy Research. They studied over 1,000 facilities, and there's a total of 902 facilities that were highlighted in this survey. They did a long-term care survey specifically to our profession. And they found a very small number of facilities that did not experience turnover. So this particular study yielded some very interesting. So from this California study on turnover, out of the 902 facilities that were studied, only 19 of those facilities had a turnover rate of 0. So that's a very small percentage. About 3% of those facilities had no turnover. We could certainly all value that information where we would hope for higher levels of 0 turnover. That should be the goal, to have great employees who are satisfied with their jobs, who don't want to leave. That's always our goal. So the average cost of those facilities that were studied, the average cost of expenses for the facilities surveyed was $167,000 and $167,063, 2.9% of their annual total costs of the facility's operations. Now, you want to take a look at that large amount of an expense, close to $200,000. And as a facility administrator, you want to ask yourself, how could we have spent this money differently? Well, with almost $200,000, this facility could have used it for renovations, for the purchase of major equipment, could have built a couple of gazebos, or purchased a couple of new vans, could have done a complete remodel and interior decor and design. So that's how you want to think about turnover. It's really an unnecessary expense at the end of the day. Turnover is going to happen, but you don't want it to be excessive to where employees leaving and you having to replace employees, that it becomes such a burden financially on the facility. Since the 1970s, studies for turnover in long-term care facilities have been done for nurses, for RNs, LVNs, and C.N.A.s. The totals of these categories range from 55 to 75% turnover. It's more than half of our staff. So we definitely want to do a better job when you get to your new facility. Ask about turnover rates and do your best to attempt to decrease turnover to maintain better quality of care for delivery of your residents. Rates for C.N.A.s. The C.N.A. is the most common caregiver in the long-term care facility. Rates continue to climb in excess of 100% in some facilities over the decades. This is worthy of attention and study. I consistently tell AITs, as you are planting firmly yourselves professionally in this profession, I encourage you to find areas where you want to make a difference. And so pulling back the layers and to determine why we experience so much turnover, it's definitely worth attention and study for improvements. Perspectives on turnover. Again, poor quality of care overall in a facility. The higher the absenteeism rate, the higher your turnover rate's going to be. Poor reputation in the facility, low morale, low wages and benefits, and also studies have proven over the years that the higher the bed capacity, the higher the turnover rate. So for example, a rural facility with small bed count, I did recruitment for AITs several years ago for an AIT program. And in Kentucky, there were a couple of rural facilities where small beds, 50 and 60 beds, very, very, very little turnover. So if you have a larger facility, over 100 beds, over 120 or over 180, chances are the turnover is going to be much higher in those facilities. Individual characteristics of the employee also relates to different perspectives on turnover. Males and females, social dynamics, the location of the facility. What is the overall environment like? Is it a chain? Is it a for-profit or not-for-profit? Non-profit facilities usually have much higher rates of stability, much lower rates of turnover. It's usually because of higher pay, more perks, better benefits. Attempts to make improvements. Reviewing this California initiative was designed to, the goal was to increase wages in facilities, but they found that that was not the success of attempting to decrease turnover. So reviews and feedback from employees who were surveyed, employees' desire to work for an organizational climate that fosters communication and teamwork. So if there's lots of changes going on in the corporation, it's better to tackle it by being honest and transparent in talking with your employees. It's better they not hear the news, on the evening news, or in social media, or from other people in the community. It's better for them to hear it from senior leadership, if that means those from your corporate office come in to your mandatory payday meetings, or to have just transparency in department head meetings, inviting key employees to come into those meetings, but to be transparent by sharing important information. Employees want to feel like they're a part of the process and that they are connected to facility management. You also want to have an organization that rewards employees. Staff wants to feel that they are being acknowledged and rewarded and recognized. Public recognition is very, very important. You want to do it on an ongoing basis, and you also want to provide ongoing and good supervision and also training. That's very important. Employees want to feel that they are valued and that senior management, and that's you as administrators, want to invest in them with good training and education. along with supervision. Other attempts to make improvements, it's always a good idea for senior management, for administrators, and key department heads to identify reasons for employees to stay on board, acknowledging their good qualities, really being intentional about telling an employee directly. I think it's a good idea for you to become a senior team leader, or to become a buddy, or to become a mentor to new employees, but just being able to acknowledge those good qualities makes a big difference. Encouraging employees to bridge into another level of advancement. For example, if you have a good C.N.A. who is really great at being a C.N.A. and a caregiver, then maybe consider them for a nursing program. You could send them back to Tarrant County College or some other school in your community for them to increase their skill sets and to grow. The same for medication aides. See about advancing them into a nursing program. Also hiring a retention specialist. That's someone who would work directly with HR and to really help increase the retention rates in a facility, and to be intentional about seeing whatever you can do to keep employees happy and to keep them on board at your facility. Leadership stability is very important. The higher the turnover amongst leaders, amongst administrators, it's more apt that, it's kind of a trickle-down effect that other employees in the facility will also experience turnover. For the administrator position, I think there's a national rate. Administrators stay in place anywhere from 18 months. The average is about 2 years. And I've known administrators who have stayed in one position for many years. In fact, I knew an administrator in New Mexico who retired last year after 25 years of service at the same facility. So it's possible. It's a highly stressful position, but if you're with the right company and the right facility and you have good training programs in place, your position, you can last a very long time. Fostering good relationships with your employees, super important, and I can't say enough about it. Make sure that you know your employees and know them well, and also know about and ask about their family members. That really shows that you care and that you're paying attention. Again, other studies have shown that people stay on board and in place because they have good relationships with their immediate supervisors and directors. Going back to some of these costs associated with turnover, the two positions with the highest turnover are RNs and LVNs. Turnover rates for these two classes, again, is 55 to 75%. It costs on the average $7,000 or higher to replace a nurse. C.N.A.s have very high turnover, about 100% in some facilities in some regions. It costs about $2,000 to replace a C.N.A. These are some of the direct replacement costs. We're going to talk in a little bit about the indirect costs associated with turnover as well. Excessive turnover, it's considered detrimental to the efficiency of the organization, also to the quality of care for the residents. To replace staff, there are other hidden costs such as recruitment, advertisement, and payments to employment agencies. Those are costs that really could be avoided, and that's usually excessive spending, although it's necessary, but those costs are avoidable. So what happens next after you experience turnover? Time and costs of HR and other staff engaged in interviews and the hiring process. These are some of those indirect expenses for your HR people to be thoroughly involved, and other department heads is involved as well. The higher the turnover, the more training the facility must provide, incurring higher costs. There's costs associated with new workbooks and training books or videos or lunch or other things that you need to purchase. Those are indirect costs associated with turnover. The more turnover, the more training the facility has to provide, and the higher those training costs that are incurred. And the larger proportion of the facility's workforce that is also involved, the higher the number of new employees, rather, in a facility, that becomes a large part of your workforce that is now less familiar with your patients and patient care. So it's going to decrease your efficiency and it's going to decrease your productivity. So when you have large volumes of new folks in the facility, it's really going to, it might feel good to say, yay, we have new employees, but you have a lot of new employees who are less familiar with your patients. So it takes time to train them and to onboard them properly. The goal, again, is to increase your retention and to increase stability, not having a lot of new employees on an ongoing basis.